nerve fibers. So classification of nerve fibers. Think of nerve fibers like roads. Okay? We can group roads by material, location, direction, etc. Many factors. So nerve works the same way. There are 6 ways to sort them out. Okay? By first one, we can sort them out by structure. So do they have insulation or not? With insulation is nothing but myelinated. If they have myelin sheath, it means they are insulated and they are myelinated. And non-myelinated is without the myelin sheath. So myelinated is covered in fatty myelin sheath like a wire with plastic coating on it. So signals are fast here. Signals are very fast here. So non-myelinated, no fatty coat. So bare wire. As you know, non-myelinated nerve signals are slow here. Next is by distribution. Where do they actually go? First is somatic, next is automatic or visceral. Two types, somatic and automatic. You remember, somatic is nothing but go to the muscles you control. Like you are the boss of the nerve fibers. And the somatic nerve. So something like lifting your arm. And then is automatic, that is the autonomic or visceral. They go to the organs you don't have to control. You're not the boss out there. So something like stomach, heart, and lungs. So they go to these organs which you can't control. Next is by origin. Origin is nothing but where do they actually start. Again, it is of two types, cranial and spinal. In cranial, as the name says, it starts from the brain. It consists of 12 pairs. Okay, it consists of 12 pairs. Examples are nerve for the eyesight. Okay. Next is spinal, and it starts from where? Obviously, the spinal cord. But this consists of total 31 pairs of nerves, nerve fibers. Okay. Example, the nerves to your hands and legs. Okay. Next comes by function, classified by function. What's their job? Function is nothing but what's their job. What do they actually do? It is again of two types, sensory or afferent, motor or efferent. We have already discussed this in previous classes. Sensory or afferent is nothing but the information from the organs to the brain or spinal cord. From the body parts to the brain or spinal cord. So, it is to the brain or spinal cord. You can feel touch, pain, heat, all of this through sensory or afferent. Now, through motor or efferent nerves, they are nothing but they take orders from brain or spinal cord to the muscles and they make the muscles move. So the memory trick we talked about was afferent is nothing but arrives. It arrives to where? CNS. Efferent is nothing but it exits CNS, brain or spinal cord, right? Okay, next is classified by neurotransmitters. And what is neurotransmitters exactly? What chemicals do they use? It is classified by what chemicals do they actually use. So it is again of two types, adrenergic and cholinergic. Adrenergic is nothing but release of noradrenaline. And this happens where? Usually in fight or flight nerves. And what is fight or flight nerves exactly? If you can remember, fight or flight nerves refers to sympathetic nerve system. It refers to sympathetic nerve system, right? And next is cholinergic. Now, cholinergic is nothing but release of acetylcholine is seen here. And release of acetylcholine is used for rest and digest. And where can you see the rest and digest mode? Rest and digest nerve in parasympathetic nervous system. Can you see now everything is so connected here? Nervous system. So adrenergic and cholinergic. Now next is, it is again classified by size and speed. Size and speed it travels. Okay? Which is known as Erlanger or Gasser. That is the ABC system of classification. So the main rule here what applies is, the thicker the nerve is, the faster the signal moves. Okay? Thicker nerve, faster signal moves. So again it has three types: type A, type B and type C. So type A is the thickest amongst all and fastest, and it has myelin here. Okay, thickest and fastest is nothing but it has myelin. With myelin obviously it is fastest, right? Okay, now alpha, which is type A, is subdivided into A alpha, A beta, A gamma and A delta. Okay, type 1, 2, 3. Okay, now A alpha is the fastest amongst all four of them. Okay, for muscle movement and position sense it is used. Then A beta is used for touch and pressure sense, whereas A gamma keeps the muscle sensors ready. It just keeps the muscle sensors ready, whereas A delta can sense the sharp and fast pain and coldness. Okay. So next is the type B, which is medium in thickness. The nerve is medium in thickness and it also has myelin here. Myelin sheath is also present here, and it is for the autonomic organs, the automatic organs. Basically, it is for the autonomic organs. You do not have control over it. And next is the type C. Type C is nothing but it is the thinnest amongst all. It is the thinnest amongst all, and it is slowest amongst all, and it does not contain myelin. Can you now observe that while it does not contain myelin, it is the cause of it being the slowest and thinnest. Okay? It can sense the dull aching pain and warmth and itch. So in these processes, it is thinnest. It is because it is thinnest, the signal also travels in very slow. So only the dull aching pain can be sensed, warmth can be sensed, the itch can be sensed. These are the sensations which can be sensed by type C. All except type C have myelin here. This can be remembered. Okay. Next is the properties. Now about the properties of the nerve fibers. First is excitability. So excitability is nothing but how the nerves react when you poke them. Okay? Now can you get it? How the nerves react when you poke them. What will happen here? Think of a nerve fiber like a doorbell. Stimulus is nothing but your finger. Stimulus is your finger. You are pressing it. Then you can see the excitability. Okay, the excitability is nothing but how easily the bell rings here. Okay, can you get it now? How easily the bell rings here. That is the excitability. And now two types of responses when you stimulate a nerve. You can see two type of responses. First is action potential and the next one is electrotonic potential. Now in action potential, you can see full doorbell ring. You can observe full doorbell ring. So this is the stimulus here. Your finger is the stimulus and the excitability what is happening is the bell ringing. Now you can see action in action potential full doorbell ring, which is high of excitability can be seen here. When does this happen? When you press hard enough, which is the threshold stimulus. Threshold stimulus is nothing but a hard enough stimulus. The stimulus is properly given. Then what happens? A big electrical signal fires. When the threshold stimulus takes place, big electrical signal fires and travels down the whole nerve. Basically, it travels down the whole nerve from the cell body to axon, axon to the terminals. Okay, so the key point what it is, it spreads to the end like dominoes falling. Okay, like dominoes falling. Example, strong touch, signal zooms to brain and you feel it. Okay, next is electrotonic potential. And what is electrotonic potential here? It is weak buzz. Weak buzz, which means no ring. It's just a buzz, it does not ring properly. Okay? When you tap softly, now here what is happening? You press hard enough. Here you just tap it softly, which is the subliminal or subthreshold stimulus. Threshold stimulus can cause high excitability, whereas the subthreshold stimulus causes very low ring, which is less of the excitability can be seen. So what happens here? Tiny local change, but does not travel. So it just gets started, it's just triggered, but it just fades away after a while. So see, key point here is again, it stays where it started and again fades away. Okay. Also, it is called as local potential or graded potential. Local potential or graded potential. Next is cathode versus anode. It is nothing but where you put the battery terminals. Cathode and anode, you have idea about it. It is about where you put the battery terminals here. So when testing nerves with electricity, cathelectronic potential and anelectronic potentials are observed here. What is cathelectronic potential? It is nothing but the change at the cathode. What is cathode? It is a negative terminal, right? Which is a negative terminal. So, change at a negative terminal is called cathelectronic potential. This can start what? An action potential. This can start an action potential. Okay. Then anelectronic potential, what it is? It is change at the anode. Obviously, which is again what? A positive terminal. And what can a positive terminal do? It cannot start an action potential, right? So it cannot start an action potential. So in simple way, you can remember only the negative terminal can fire the nerve. Only the negative terminal can fire the nerve. Okay. Next is action potential numbers for nerves. So same idea as muscle, just different in numbers. Okay. The resting phase is about minus 70 millivolts, which is where the nerve is chill and waiting. The firing level is minus 55 millivolts. If it hits this, then you can see the action potential starts from there. Depolarization peak. Okay, depolarization peak is at minus 35 millivolts. Okay, it is top of the spike. Usually starts at the initial segment where the axon begins. Now this is the image of the actual action potential. Okay, this graph shows what happens when the nerve fires. Now can you see resting phase? This is the resting phase. So this is the resting phase, which is minus 70 millivolts. Okay. So before anything happens, the nerve is just chilling and waiting there. Okay. Inside is negative compared to the outside. So this is negative, that is outside, which is positive. Okay. This flat line is minus 70 millivolts, which is called resting membrane potential. Stimulus artifact is nothing but, this is stimulus artifact, okay? This is nothing but the tiny blip when you zap the nerve. This is the tiny blip. You can see this is a tiny blip when you zap the nerve. It's just electrical noise from the stimulator, not the nerve itself. Okay. And coming to the latent period, it is a short delay after the zap. So initial zap, this is just the noise from the stimulator. It's electrical noise, just electrical stimulants. That's it. Okay, it is not the nerve itself. Now in latent period is nothing but the short delay after the zap. Nerve is deciding whether to fire or not. So here what is happening? Nerve is deciding here now. Should I fire or not? Okay. That is known as this is known as the latent period. Now firing level. Firing level is approximately minus 55 millivolts. Can you see? 55 minus 55 millivolts. If the stimulus is strong enough, the voltage raises to about, minus 55 millivolts. This is the threshold point. Okay. Now here if you hit this line, the nerve has to fire. If you don't, nothing happens. All or none. If you hit this point, the nerve has to fire. Otherwise, it is all or none. This is the threshold. Okay. Now depolarization. Now what is this? This is the depolarization. How does this happen? The big spike up. Once it is minus 55 millivolts is, once the minus 55 millivolts is hit now, the big spike you can see is, this is the spike where the sodium channels fly open. Here what happens? The sodium channels open here. They fly open here. Okay. Sodium rushes into the nerve. They are open here and it rushes into the nerve. Inside quickly becomes positive. After it comes into the nerve, it becomes positive and it reaches up to where? Up to minus 35 millivolts. When sodium rushes into nerve, it reaches minus 35 millivolts. After that, what will happen? Overshoot. That is, this is the overshoot. This is actually known as the overshoot because it crosses the 0 millivolts level. The nerve actually flips polarity for a moment. Then comes what? Then comes the repolarization. Coming back down is nothing but repolarization. Sodium channels, what will happen? They will shut down here. Now here what will happen? Sodium channels will shut down. Okay. Will shut. Potassium channels will open here. Now what will happen? Potassium channels will open. Sodium channels will shut down. Potassium channels will open. And what will they do? Potassium channels will rush out, making inside negative. Potassium channels will rush out, making inside negative. Voltage drops fast backward towards where? Towards the minus 70. It will again come here up to minus 70 millivolts. Okay, after depolarization is nothing but the early part of falling stage. This after depolarization is nothing but early falling stage. This is falling stage, right? This is early falling stage. Now after repolarization, this is after repolarization is nothing but 2 negative dip. When it is 2 negative dip, then it is known as after hyperpolarization. After hyperpolarization is nothing but 2 negative dip, where the potassium channels are slow to close, almost they close. Too much of potassium channel leaves here. All potassium channels leave here. And close. It leaves and closes. So again, back to the resting point. They get back to the resting point. Sodium potassium pump slowly resets everything. So line drifts back up to again minus 70 millivolts. Nerve is ready again. So this whole process takes about 1 to 2 milliseconds. Within milliseconds, this whole process takes place. So now you can remember it is at rest. Then what happens? It will hit the threshold. Then from there, what will happen? Spike up of sodium channels can be seen. After which sodium enters the nerve. Then drop of potassium channels can be seen. After which potassium leaves the nerve. Overshoot takes place. Now this is overshoot itself, right? Overshoot takes place, which is after hyperpolarization. Okay. Now next is electronic potential details. Subliminal stimulus is the which is makes the tiny depolarization, which is about minus 7 millivolts. Now what is the problem here? It needs 15 millivolts total to hit the firing level at minus 55 millivolts. It needs 15 more to hit minus 55 millivolts. So 7 millivolts is not enough. So no action potential. Now did you understand? It is giving only 7 millivolts. If you can see here, this needs more to hit the firing point. To hit the firing level, it needs 15 millivolts, but it is giving only 7 millivolts, which is not enough. So no action potential in subliminal stimulus. So graded here, how the harder you tap, the bigger the buzz gets until it hits 15 millivolts and fires. Okay, the harder you tap from here, the harder you tap, it has to reach this point here. Okay, until it hit 15 millivolts to reach the minus 55 millivolts level. Now does not obey all or none law. It can be small, medium or big, how much ever it can be. Now is Chronaxie is nothing but the nerve health test. So a way doctors check if a nerve is damaged or not. How measures how long a current needs to be on to make the nerve fire. How much the current it has to have to make a nerve fire. So what is the tool here used is Chronaxie meter.